House Bill 1519 deals with Missouri healthcare conscience in relation to sex reassignment and gender identity. Missouri has acted to protect minors from certain hormone treatments, gender reassignment surgeries, and other similar procedures through the SAFE Act. Now, Missouri's existing healthcare conscience protections should be expanded to include new language protecting medical professionals who do not wish to provide those transgender medical services that are still lawful. HB 1519 is designed to ensure that doctors, nurses, and other medical professionals aren't forced to leave their ethics and religious beliefs at the door when they serve their patients.
I just want to point out that as much as folks say that this isn't a priority, we are sitting here in this hearing discussing this bill in a state where, in the space of protecting kids, we turn down federal money to feed kids over the summer. And yet we could be figuring out as a state how to be more efficient in that space, how to make those departments run efficiently so that we can protect kids and make sure they have the basic needs like food. But we're not doing that. We're sitting here talking about, we're sitting here really just being not minding our business about people's genitalia.
As healthcare becomes increasingly politicized, medical professionals are being forced to choose between their deeply held beliefs and their livelihoods. Among Christian medical students, 36% say they have experienced discrimination during medical school based on their moral, ethical, or religious beliefs, or have been pressured to violate those beliefs. 1 in 5 medical students say they have chosen not to practice in a certain field because of hostility toward their beliefs in that area of practice. Most of the time, these students were on track to become pro-life OBGYNs who would have been able to provide critical care for women and their unborn babies. 9 out of 10 religious doctors, nurses, and other medical professionals say they would rather stop practicing medicine than violate their ethical, moral, or religious beliefs. Regardless of your beliefs about the practice of medicine, we should all agree that those in the medical field should not be forced to participate in prescribing drugs and performing procedures that violate their core beliefs.
Okay, so I am interested to know, when you say doing harm, that you believe some of these physicians are doing harm, I'm interested to know who you, like the definition of harm, whose definition of harm is prevailing here. Because, I mean, I could give you an illustration of you doing harm to me where you think you're protecting me, but I feel like you're doing harm. And I'm interested to know whose definition of harm prevails in your legislation.
So appreciate that, Representative, appreciate that question, and that's a good conversation to have. I don't think that I said that I feel like that this is doing harm. I think I said there are certain medical professionals that do.
Okay, so then the answer to my question is the physician's definition of harm, not the patient's definition of harm.
So there are physicians that would believe that unnecessarily, for example, unnecessarily removing healthy body parts of an individual because they are struggling with gender identity or have gender dysphoria would actually be harming that individual.
So again, the physician's definition of harm, not the patient's definition of harm.
So
because when I'm sorry, let me just clarify. Because when I seek health care, I don't seek it for the physician. I seek it for my health, not the physician's health. So the definition of harm would be my definition if I am seeking health care. And in that, I have a choice of the provider of that health care. But when we are defining harm, we should be using the patient's definition, not the physician's.
Well, I think it's important to note that no individual should have the right to compel someone to perform a service for them that violates their conscience in this particular type of situation. I'm certainly not saying that we're going to outlaw these drugs and procedures for adults.
Are physicians being forced to perform gender-affirming care currently?
So I expect, following me, you're going to hear some testimony from some folks that are either in the medical community or are training to be in the medical community. And they may be able to tell you about some experiences they've had, some discrimination that they have faced, and why the need for these protections.
Discrimination from employers?
it could be there are, I think I read in my opening statement something about medical students. I mean, there is an atmosphere where certain folks feel like that if they're going to serve in the medical community, the only way they're going to be accepted is to violate their conscience, and they're not going to do that. And so we are going to be missing out on some.
No, that's a perception, not really based on evidence or reality.
Well, stay tuned, Representative, because I believe you're going to hear some evidence before this hearing is completed.
Okay. All right, I look forward to it. So in your bill, there's a phrase that describes or other person, specifically, contrary to the established policy of or the moral, ethical, or religious belief of such healthcare institution, healthcare professional, or other person. Can you explain what or other person legally means in your bill?
So, Representative, could you point me to the location of that statement you're reading so that I can see it?
It is lines 23 and 24. Lines 23 and 24. So, transitioning of such procedures, contrary to the established policy of or the moral, ethical, or religious beliefs of such healthcare institution, healthcare professional, or other person.
So we're trying to, what we're trying to do here is just make sure that we cover our bases with regard to protecting conscience of medical providers, healthcare institutions, and that sort of thing. This is what I believe we're doing with the language here.
Okay, so let's say I'm the cashier at Walgreens. Someone comes up to me and they are purchasing a prescription. They were prescribed. Their doctor is performing gender-affirming care, prescribing medicines, et cetera, et cetera. I decide that it is against my moral and ethical belief to complete this transaction. This is actually a real story. It happened somewhere where somebody decided that they would not complete the transaction at Walgreens. The cashier at Walgreens would not complete this transaction because of their moral and ethical belief against the person who was standing in front of them. Is that legal in your bill?
That is, I appreciate that scenario, Representative, and that's the first time I've heard about that. And if I'm understanding you correctly, your concern is that the language where it says "or other person" could include that individual at Walgreens.
Could include the individual at Walgreens. Could include the administrator at the hospital who's doing intake. Could include really just anyone.
Well, I am happy. That is certainly my intent here is to craft a very narrow bill, and I'm happy to have conversations with anyone that thinks that it's too broad.
Would you be amenable to excluding that specific phrase from the bill?
I am open to having conversations about that. I will not commit to excluding something from the bill until I've had the opportunity to look at it from all angles, because there could be something we're missing. There could be a necessity for it to be there, but I am open to having that conversation.
Okay. So the next question is kind of the same, along the same lines of the perceptions of individuals, the perceptions of people. So there are certain individuals, women who are diagnosed with polycystic ovarian syndrome or some type of thyroid disorder that are prescribed medication that is also prescribed to trans individuals. Could a doctor look at that medical chart, see that that person has been prescribed this specific medication, and then decide they don't know what the specific genitalia of this person or what their sex assigned at birth was, and decide that they think they might be trans or they think they might be something other than whatever the reality is for them, and decide not to provide care to that person?
So I appreciate that question, Representative, and let me make sure that I understand what you're asking. I think your concern is there could be an individual that for their physical health, they need drugs that are also used for transition. Would a doctor be able to deny those folks the drugs they need for their physical health because of my bill? No, I do not believe that.
We could be figuring out as a state how to be more efficient in that space, how to make those departments run efficiently so that we can protect kids and make sure they have the basic needs like food. But we're not doing that. We're sitting here talking about, we're sitting here really just being, not minding our business about people's genitalia. So in that space, I think that we could be doing a better job as a state of protecting kids in other ways, other than not minding our business about what's happening with their personal health and with their gender.